My first impression of Peoria was that it was a small town and that there wasn't that much to do. But once I got here, everyone was so warm, so friendly.
Driving through Peoria for my interview, I was really amazed and impressed.
It's a smaller city, but I think that sometimes it actually feels bigger than it really is.
Peoria to me is just a great place to live. It's really easy to get around. You don't have to fight traffic after a long day of being on call, and it's really affordable.
There are a lot of things I really love about Peoria.
As a family, we love to go out and go to orchards. We love to come to the Riverfront Museum. We love to go to the Children's Museum here. We love to go biking.
So I love how easy it is to get around. I love the convenience of the community. There's affordable housing.
I can truly say it's the best of both worlds. You have a lot of the big city amenities without the traffic, which is awesome.
We wanted an international airport and a Costco, and it had both of those.
The idea of being able to run to the airport, park for free, and be able to fly anywhere I want to fly, I really love that about this community.
The Department of Surgery here is a very well-rounded group of individuals who help produce outstanding clinical surgeons. This allows people who train here to be good surgeons out in the community when they leave here, or offers them the opportunity to go out and do fellowships when they're done here. We offer 4 categorical spots a year here at the University of Illinois College of Medicine at Peoria, and it's a 5-year program for which the residents will matriculate through multiple steps. One of the great things about the program here is as you progress, your ability to do more is allowed to be done much easier being a smaller program with the faculty understanding what your capabilities are when you walk into the operating room. Our goal is every day is to try to challenge you to become a better surgeon, and we will do that. So there is no case that is a chief level case in Peoria. It's really whatever you're capable of doing here.
Hi, my name is Elise Hwang. I matched into this Peoria program, and I'm so happy that I did. I really think Peoria is a special place, and I'll forever remember it as such. And honestly, a lot of us are considering even staying here to practice too, just because of the wonderful experiences we've had.
And Peoria has been quite a bit of a transition. I think the first time I really knew about Peoria was actually when I got the interview invite. I thought it was close to home. I'm originally from Chicago, so I thought, hey, let's give Peoria a try. Definitely was surprised in a good way when I came here to visit. It's a beautiful riverfront, I think was the thing that originally caught our eye. But as we got to know the people around here too, it's very family friendly. My wife and I have been married for 8 years now, and we have a 2-year-old and a 4-month-old. So we were definitely looking somewhere that was very family friendly experience.
The great thing about Central Illinois is outside of Chicago, outside of St. Louis, we're it. So we have an extremely large catchment area in the central northwest part of Illinois. And so we get a wide range of pathology here that would be comparable to any major city. The great thing about having a smaller group of students each year is the residents really get to know each other. They become friends. Instead of competition, it's more of a support staff. There's also great support from the attending staff as well.
At first, like I said before, I was a little hesitant because it's a smaller city. It's not really one of the main cities like Chicago or Nashville, but it actually ends up becoming an even better place to train because everyone is so devoted to contributing back to Peoria and giving back to the town.
We have 2 major teaching hospitals here, OSF St. Francis Medical Center and Unity Point Methodist Hospital, which offers opportunities for the residents to participate in their educational program at both institutions, which offers a wide range of surgical endeavors. We also have a simulation center that's actually world-renowned, the Jump Simulation Center. So it's very common for our residents, especially in the first couple years, to spend a fair amount of time in a simulation center where you'll actually, before you actually go into the operating room to be doing some of your first cases, you will have already had the opportunity to practice some of that skill set on a simulator.
We're very lucky to have the Jump Simulation Center here in Peoria. It's a cool story, actually. Do you guys know the way that we got that? Was one of the pediatric surgeons here actually saved, I can't remember how old the child was, but their ATV had flipped into a lake, and the child came here. He was like unresponsive, but one of our ped surgeons, Dr. Pearl, saved her life. And so her grandparents are the ones that donated back to the hospital, and they gave us this wonderful state-of-the-art simulation program.
We also spend quite a few months over at Methodist. It's part of Unity Point Health, and that's more community-based. And so we work directly with community surgeons who are doing the more routine procedures, like taking out gallbladders or cholecystectomies and hernia repairs and kind of hiatal hernias, things like that, that at a specialized center, we do a few, but there was one day where we did 4 or 5 of these in a row, and I feel like I could really feel my skills were improving just case by case on that aspect.
The other advantage that we really have is we have an extensive robotics program here, which most places the only way you can get that kind of experience is with a fellowship in robotics. Coming out of here, you would qualify probably for most any institution to be able to be granted robotics privileges. The same thing's true for advanced laparoscopic procedures. We do an awful lot of advanced laparoscopic procedures that, again, coming from here and graduating from here, you would have no problems getting any type of credentials that you would need in doing advanced laparoscopy wherever you wanted to go.
You'll get the training here that you won't feel like you need a fellowship after, which I think is really important for some people that are looking at residency programs. That's a question you want to ask is, are you comfortable practicing immediately after training? Because the trend these days is to do a fellowship, and a lot of the times that's based on the comfort levels of residents. We're lucky because we get to get in the operating room right away. Your first day of intern year, you might take on an appendix, so it's very exciting.
So we have a group of faculty that are truly committed to education here. They want to be a part of teaching you to become a good surgeon, as well as teaching you to how you become a good surgeon. And so we interact with the residents quite a lot.
There's 20 residents in the surgery program, and we're pretty close. We're pretty much like a family. So it's a lot of fun getting to know people, and as the years go by, developing a relationship with them.
So we were definitely looking somewhere that was very family-friendly experience. And I think Peoria has a lot of that, as well as the hospital being nearby is always a plus and a benefit. As well as the cost of living for us to buy the house that we did, it's about a third of the price of what we would have paid up in Chicago. And so it's very affordable to live here, and we feel like there's a lot about Peoria that's up and coming. A lot of fun restaurants and areas that are fun to go and kind of spend some time with my coworkers.
Most people think of Illinois as being very flat. Peoria is actually up on a hill overlooking the river, and it's actually a very majestic, beautiful scenery from here. And it's really a very nice town to live in and a great town to raise a family in or be single in. It offers multiple opportunities which are really not affordable to the large cities.
So I'm in the general surgery program. 4 general surgery programs in general. There's academic settings, and then there's also community settings. I picked this program because it was university affiliated community program. So you actually see a lot of different types of practices. For example, for general surgery, we're actually affiliated with the university, but a lot of the surgeons that we work with a private group. So it's really helpful to see those different groups and different settings interact with each other, even just in our training. I think if I had just gone to an only academic program, I would have never experienced that, and it kind of would have shifted my jobs and my searches in the future more sort of in a narrow search instead of really understanding what it's like to practice.
Yeah, I think the other selling point of our program is that our attendings are so very hands-on. We work directly from day one with our attendings, so as an intern, you're actually operating even. My first day, I was in the OR right there next to Dr. Anderson. We were doing a surgery together, and I was just blown away. And that's definitely continued over these past 3 years now.
So what are we looking for in a candidate here is we really want somebody who's going to fit in. We want somebody who's going to work hard and be a good team player, and is somebody who really has a tie to the Midwest. Ultimately, what we really like to be doing is cultivating more physicians to be a part of surgery in the Midwest here.
Hi, my name is Julia Samanda, and I'm from Wausau, Wisconsin.
From Markham, Ontario, Canada.
From Joliet, Illinois.
From Rockland, California.
From Kansas City, Missouri.
From British Columbia, Canada.
My name is Melissa Medina, a recent graduate from the General Surgery Residency at UEComp. Currently, I'm about to start my cardiothoracic surgery fellowship at Stanford.
Hi, my name is Vadim Lyuksemburg. I'm from the northwest suburbs of Chicago. I'm one of the surgery residents at University of Illinois, College of Medicine in Peoria.
So I knew that there was something special about this program immediately.
I loved my time in Peoria as a resident and as a medical student.
I was literally home in Chicago pretty much every weekend my first year, but by the end of all 5 years, ask any of our attendings, I absolutely could not get myself to leave.
It's a really tight-knit community.
If you come to our program, you get to play with cool toys such as this virtual reality unit.
I really wanted something that was family-friendly and well-rounded.
You have an incredibly supportive learning environment, and the volume of patients that you see is incredible.
I can't quite put a finger on one thing that makes me love this place so much. Maybe it's the camaraderie or how close we as residents are with our attendings. But what you get here in Peoria is family. We fight like siblings, laugh, and love each other like siblings, all to make ourselves better, for each other, and more importantly, for our patients.
Here's one of the benefits of coming to Peoria is you get to put in some work with Life Flight.
This is one of the rooms where we do advanced modeling and virtual reality, and this is one of the units.
I really encourage you to look into this program because there are so many wonderful benefits and you'll have a really great experience if you train here.
Hope to see you in Peoria.